Welcome to your cardiac rehab aerobic exercise session. So we're going to take you through about an hour's worth of exercise, including our warm-up and our cool-down at the end and our conditioning phase in the middle. And I'll just talk through some of the safety elements with you which you already will know, but we'll recap those as we go through. So marching on the spot as always, our linking movement constantly will be marching on the spot, and we'll return to this each time we need to, and I'll remind you of that. So just starting our warm-up movements then, so we're just tapping a heel to the front as our first movement. Now remember, as we go through this, you'll be training at your own pace, and that would apply to your warm-up as well. So the warm-up, if you remember, should feel very light. Just a brief recap on our Borg scale that we use, running from 6 to 20, and 9 on that scale is very light. So going from an 8, 9, 10 on the scale before we get into our conditioning, and back to marching again. And our conditioning obviously will require more effort before we then move into our cool down. So continuing to march for the moment, linking each of the movements that we make with 30 seconds or so of marching. And now we're into the tap to the side, so just an alternate toe tap to the side. Try to do this as a leg moving out and in rather than shifting your whole body sideways. So the difference between doing this movement here and doing this movement here is just about effort. So let's just keep it to a toe tap to the side for the moment. So again, if you feel this is too quick for you, then we can slow this right down so you're making the movement much more slowly. If you feel you can go a little bit quicker and you're not getting any shortness of breath, then that's fine. Please go ahead and do that. And then we go back to marching. So remember, obviously, if you get any chest pain during the course of this workout, you would stop, give yourself the opportunity to recover. If your chest pain doesn't go away, then we're either using a GTN spray if you have one, or alternatively seeking advice from a medical professional. Maybe call your GP, call 111 or 999 if you feel you need to. And then we're just going to toe tap behind then. So just from the side, making quite a big movement, tapping our feet behind us. And again, we're just trying this for about 30 seconds. And then we go back into our march. So you notice at the beginning of the workout we're not using our arms at all, and we're working to using our arms as we go back towards the second half of the warm-up. So now I'd like just to take a step forwards and then take a step back. No arm movement needed, so just stepping forward and back. And again, this can be as fast or as slow as you want it to be, but always keeping in that very light feeling with the movements that you're making. If you're feeling really brave at this point, you can do a tap change and change the leg that you're coming forward and back with. But as long as we're moving, that's fine. And then we're going back into our march again. So remember, while we're doing this workout, you need to stay hydrated. So if you have a bottle of water with you, that's always going to be a good idea. Just keep drinking throughout the workout. You'll be losing fluid even if you don't feel that you're sweating. So please do maintain your fluid, and that will help maintain your blood pressure. And now we'll lift a knee then, tap your right knee with your left hand and your left knee with your right hand. So once again, making these movements as fast or as slow as you want them to be, but bearing in mind all the time we're still warming up. So just a reminder also of what we're going to need in the room. So we need a chair for doing our sit to stand movement. We'll need the band for one of the exercises that you'll all be familiar with, and we'll also need a couple of little hand weights or tins of beans or bottles of water, whatever you have available to create a little bit of resistance. And then we have the space against the wall for doing a press up against the wall. And then we're back into a march. So next movement then, just to show you from the side, to remind you, we're just going to do a leg curl. So I'm just curling my heels up behind me, trying to kick my backside, and just gently roll my arms back. Doesn't need to be a big movement at this stage, so we'll do this one a bit later on with the weights. And make sure that your heel's coming straight up behind you. You don't really want to be flicking across because that's going to damage your knees, so just straight up behind you if you can. So a number of you have mentioned the fact that breathing is a bit of an issue with some of these exercises, just remembering to keep your breathing going. So always remembering we're breathing out with the effort that we're making and breathing in the more relaxed part of the movement. So with something like this, I would tend to breathe out as my heel comes up, and in again with my foot returns to normal. And then we go back to our march. Obviously, while you're doing this exercise, if you find it a little bit boring doing it without any music on, feel free to play some music. I haven't got any music on here, so that doesn't interfere with the pace that you're going at. Please do bear in mind that you don't want to play anything too fast that then drives you along at a pace that you're not comfortable with. So providing you can go at your own pace, then using music is fine. Okay, so we're going to the toe taps to the front, so just slowly tapping toes forwards. And we're just going to loosen our shoulders up a wee bit now, so we're just going to do our breaststroke movement with our arms. So just a little breaststroke movement. Trying to get your shoulders through a decent range of movement, and we're trying to loosen our shoulders up a little bit before we start doing the exercises. And just keep tapping forwards, and then we can go into a shoulder roll forwards. So the shoulder roll forwards can be a big movement such as this one, or alternatively, we can just roll the shoulder up and forwards. So it's your choice. Certainly if the bigger movement starts to make you feel as if you're getting a little bit short of breath, that would be wrong, so please take it down to a low level. So feeling like my shoulders are getting a bit more mobile now, I'll move from this movement into a backwards shoulder roll. So again, this can be a big movement, almost like a backstroke in a swimming sense, or alternatively I can just lift my shoulder and roll back. So again, whichever one you feel most comfortable and is easiest for you to do. And then we're just going back to a march again. And now we're just step side to side. So this time we're taking a positive step with both feet moving. And as we're making this movement side to side, we're just going to put an arm across your neck, hold onto the elbow and just pull that towards you. And that's going to stretch the back of your shoulder, down the side here a little bit, and also into the middle of your back. We're only going to hold these stretches at the beginning for a very brief period because they're practice stretches. Relax there and just roll the shoulder a couple of times. And then we go across to the other side. And then we'll repeat all of these stretches when we get into the cool down at the end. And relax there and just roll your shoulders. Can I just remind you at this point as well, back to marching, of the importance of keeping moving the whole time. So if you need to take a drink, that's absolutely fine, obviously, as I said earlier on, but please do keep yourselves marching on the spot or some sort of foot movement. Okay, so we're into the warm-up a little bit now, so we can start doing something with a bit more vigour. So we're going to incorporate some arm movements now then. So back to tapping your heels forwards, and then just curling your arms up to your shoulders. So again, it doesn't need to be overly vigorous, we're just trying to gently increase the intensity that we're training at. Again, just trying to do these movements for around about 30 seconds. Doesn't have to be exact, as long as we get through a 15-minute warm-up, then that's fine. And then we go back to our march again. And now we're going to start the process of stretching some muscles in our legs. So we're going to do a calf stretch. So the calf stretch involves that big stride forwards that we've been doing, the front knee bent and the back leg straight, the heels on the floor, and the back foot is pointing in the direction that you're facing. So I'm always going to do the opposite leg to you, so you'll be coming forward with your left leg for the first one. I'll come forward with my right leg, so we're mirroring each other. So left leg forwards, then right leg behind, front knee bent, back leg straight. So from the side, the movement looks like this. Keeping myself upright so that I can breathe nice and calmly and deeply. There is no need to lean forward when we're making this movement. We're just holding for 5 seconds or so, and we bring the leg in and we're back to marching. And then after a few seconds of doing that marching, we're going to go back into the stretch again, but for the other side. So right leg forward this time, left leg behind. As you can see, I've kept some width in my stance here. So by keeping that width, my balance is easier to maintain. If you need to hold on to something, that's fine. These stretches are not balance tests, so please feel free to hold on to a sideboard or a kitchen top if you have one available. And relax there, bringing the leg and back to marching again. So next then we go back to the taps to the side, when we go, foot goes out and in, so right leg out, then back in again, left leg out, then back in again, and as we're doing that we're raising an arm to the side as well. So again, just increasing the amount of effort we're making by about 15% or so by incorporating a movement that includes our arms. And then we go back to our march. And then we're going back to our stretches again. So for this next stretch, we're stretching the inside of a leg. So I'd like you to take a step out to your left and go onto your bent left knee. You keep your right leg straight, you get a stretch onto the inside of your right leg. As you can see, my feet are pointing forwards towards you and I'm facing forwards. I'm holding my body weight on my bent knee, and I'm keeping my head up. Just for 5 or 10 seconds, and then slowly up again from there and back to marching. So it's important to keep your head up when we're making any of these movements to reduce the risk of any lightheadedness. So going from a low position to a higher position is always potentially going to cause lightheadedness. But if you keep your head up and make the movement slow, that should reduce the risk of that happening. And then we'll take a step out the other way then. So out to your right this time, hands onto your right knee, keeping your left leg straight. Breathing deeply while we're stretching. Please don't hold your breath because that will make you feel unwell. So breathing deeply all the time. And then we slowly come up from there and back to marching. So we're nearly at the end of the warm-up. And we'll be going into our circuit in a short while. So again, just to repeat, and I will keep repeating this throughout, please do remain hydrated, take a drink when you need one. So the next movement then, we're going to return to the taps behind. So from the side, I'm tapping an alternate foot behind, and then I can raise an arm to the front at the same time. It doesn't matter which arm you raise, it's just making the movement. So during the warm-up, these movements can be quite big. During the cool-down, they're likely to be quite a lot smaller. So when we're making these leg movements, they'll reduce in size and speed. And then we're going back into our march. And then the last stretch we're going to do at the beginning then is going to be for our hamstrings. So if you remember, this is the one where we take a very small step forward with one foot. Keep that front leg straight, put your hands onto the back knee and bend the back knee. And you're going to push your backside out a little bit away from you so that you can keep your head up. So showing you from all different angles then, so left foot forwards if you would, so left foot forwards, keep the left leg straight, hands onto your right knee, and bring yourself forward so you get a stretch into the big muscle at the top of the back of the leg here on the straight leg, between the back of the knee and the bottom of your backside, and just take yourself down until you get a stretch there. So from the front, we're in this position, and I'll show from the side on the second one. And then we're slowly up from there and back to marching. And you'll notice I keep my head up the whole time I'm making that stretch. And then for the other side then, with your right leg forward this time. So right leg forwards, keep the right leg straight, hands on your left knee and bend your left knee. Backside pushed out, head up, breathing deeply all the time we're stretching. So from the other side, that's the position we're in. And again, just holding for 5 to 10 seconds, and then slowly coming up from there, and we're back into our march again. So we're ready to start the circuit then. So just to remind you, we're going to do 30-second gaps between each exercise. Each exercise will last a minute. There are 10 exercises. We'll then take a minute or so break, and then we'll repeat the process before we then go into doing the cool down. You can obviously adjust the way you do this workout by leaving exercises out, or not doing the second round of exercises, or only doing it in parts. It's entirely up to you. It depends how you feel and whether or not you feel you're getting a bit of a workout. So before we start, I'm just going to take a quick drink, and I suggest perhaps you do the same thing. So just having a quick drink of water. I'm still moving my feet while I'm doing this. So just keeping myself hydrated all the time. And remember, I have my chair, my bands, and a couple of hand weights. When we do the press up against the wall movement, I'm going to have to turn my back to you, so I'm going to be doing that movement here. But I think you all remember how to do it. So we're doing a press up against the wall for the second exercise. So I'm going to start the watch now, so we have a 30-second countdown before we start making the movement. And if you remember, the first movement then is going to be an elbow to an opposite knee. So we're just going to do it in this marching kind of way initially. If you can't reach your knee with your elbow, then at least try and rotate as far as you can comfortably. Breathe out each time your elbow goes towards your knee. So we'll start that in about 10 seconds. Remember, you're going at your pace. And there we go. So starting now then, elbow to an opposite knee. I'm trying to rotate my shoulders a little bit as well, rather than just putting my knee across my elbow across like this. And by making this rotation, I'm working myself through my middle a little bit, at the same time as making an aerobic movement. So as I said, if this becomes a bit difficult for you, or you can't quite get round, then I can adjust to just this movement here. I'm still making a movement, I'm still doing myself some good, and I'm exercising within the bounds of where I feel I'm capable. And about 20 seconds left on this one. And less than 10 seconds to go. And at the end of this period, then we go back into our march again, as always. And back into the marching again. So exercise number 2 is going to be the press up against the wall, which I'm going to do here. Press up against the wall requires your hands at shoulder height and shoulder width, lowering yourself towards the wall and then pushing away. Lowering yourself and pushing away. And we'll do this in 10 seconds. Breathe out as you push away, breathe in as you lower yourself towards the wall. So in 5 seconds time, and off you go then to the wall. So forgive my back. So lowering and pushing away. Please remember that we come off the heels all the time when making this movement. So coming up off your heels constantly to maintain a little bit of foot movement. I'm keeping my body straight. I don't want my hips sagging. I'm breathing out as I push away, I'm breathing in as I lower myself forwards. Maintaining that strong, straight body, so keeping your core nice and strong all the time. Keeping your tummy with a little bit of tension in it. Please don't put your hands too high when you're making this movement. If you go up here, it becomes a very different movement, which is quite difficult. So keeping your hands at shoulder height. And relax there, we're back into our marching again. And the third exercise is going to require your chair, so please have that chair available. And we do our sit to stand. So remember, when we stand up, we breathe out. When we sit down, we breathe in again. Exercising at your pace. Please make sure you fully stand up and fully sit down. And we're going to go in 2 or 3 seconds. So round to your chair, and then we're up and down from the chair. So as you can see, I'm keeping my head up. Don't allow your head to drop. It's very easy when you're doing a stand up from a chair to allow your head to drop and then come up from that position. Please don't do that. If you find that difficult, then it's a good idea to focus on something high. So maybe where the ceiling joins the wall. Focus on that with your eyes all the time, so that makes you keep your head up. And again, breathing out as I stand and in as I sit. And relax there, and we go back to our marching. So exercise number 4 is going to be the lateral step. So the lateral step is a big step sideways and tap the trailing leg behind the foot that lands first. So just that movement there. That's what we'll be doing in a moment. So in 3 seconds. And off we go then. So tap to the side or step to the side and tap behind. So remember, this step should be bigger than the steps that we were doing during the warm-up, so you need to push a little bit further, otherwise we've gone back into just doing a warm-up again. So really try and push off the leg that moves second. So the second, when you're moving to the right, you push off with your left leg, and vice versa. And down to 10 seconds of this one. And then back into our march again. So think about regulating where your breathing is at the moment. We're going to get into doing the lunges next. So when we're doing these exercises, we want to get a little bit short of breath potentially, but no more than a little bit of shortness of breath. So our lunge will be forward and back, alternate legs, forward and back, alternate legs, with that knee dropping down towards the floor but not touching. So starting from hip width then, here we go. So if you'd like to start now, if you want to put your arms out to the side for a little bit of balance, that's fine. If you want to hold on to something for balance, that's fine as well. From a breathing viewpoint on this one, I would tend to breathe in as you come forwards and breathe out as you push back. If you're finding this difficult for your knees, then obviously you make the movement a little bit more shallow. But still trying to bend the back knee a little bit. Okay, so just a few seconds left on this one, about 10 seconds. back into our march again. So we're on to exercise number 6, and that's going to require our band. So if you'd like to get your band, take it up around your back, underneath your arms, and then we're going to be making this movement where we're tapping behind, if you remember, and pushing the band away. So 30 seconds of making this movement. So off we go. So band around the back, tapping your alternate foot behind and pushing the band to the front. Both arms at the same time, only to shoulder height. If you find yourself starting to struggle a little bit with this, with shoulder fatigue, then obviously just take a break. Make the foot movement reasonably big if you can. Obviously one of the ways we can increase our intensity is by making the movements bigger or by speeding them up. And we can increase the resistance or decrease the resistance on the band by moving our hands either closer or further apart. From a breathing viewpoint, I will be breathing out as I push the band away from me and in as the band comes back towards me. And relax there, we'll put the band down. We're now going to get the weights, whatever weights we have. So just grabbing your weights. So whether they be dumbbells, light dumbbells, probably a maximum of about 1.5 kilos if you're using dumbbells, or a couple of bottles of water, or tins of beans or something similar. And the movement we'll be making will be this diagonal movement, or something which looks vaguely like that. So keeping marching until we start. And we'll start now. So just pushing the weight away from you in the opposite direction to the direction the foot's going. Using the same arm for the same leg. And again, just going at your pace. The bigger the range of movement, the more effort you'll expend. And obviously you can increase your speed if you wish. I'll tend to breathe out as I push the weight away, and in again as the weight comes down towards my chest. Still thinking about where I am on that Borg scale, so only going up to a 13 really at the moment. So a little bit of puffiness is fine. If this feels very light, then you need to work a little bit harder. And relax there. Back to our marching. We're going to hold on to the weights. We have 3 exercises to do with the weights. And the next one will be the leg curls with the pullbacks with the arms. So we're going to be curling the legs like we did in the warm-up, but we'll make it more vigorous by just putting the arms back, holding the weights. So remember, I can make the arm movement really quite big, or I can make it a smaller movement if I wish. Starting now, doing your leg curls, putting your arms back. And remember, my left heel is going to the left side, my right heel to the right side. I don't want to be kicking across. And I'm going to tend to puff out with the effort again. So as I pull my arms back and kick my heel up, that's when I would puff out. And I breathe in again as I return to my normal position. Always trying to make sure you get your heels up towards your backside so your hamstrings are working quite hard, going through a good range of movement. So nearly through this minute. And then we go back to our marching again. So just 2 exercises left to go then before we take a short break. The next one will be just stepping side to side, a much smaller step than the lateral step we did earlier on. Dumbbells up at chest height, and then we're just pushing the dumbbells to the front one at a time. This is not a punch, it's just a push. So if we punch and it becomes too quick, we may well damage elbows. So just make sure we don't do anything that's going to injure ourselves. So if we're ready, so stepping side to side then, starting now and just pushing the weight to the front. And again, it's your pace. So if you feel you need to go more slowly, then we'll go more slowly. If you feel you can speed up a little bit, then you can speed up. And again, from a breathing viewpoint, I would tend to breathe out as I punch forwards, or push forwards, I beg your pardon, and breathe in again as the weight comes back towards my chest. So just keeping that going. Remember, you can take a drink at any point. At the end of this exercise, we'll be putting the weights down and just return to marching without the weights. And we'll do our last exercise. And relax there, so the weights can go down, and we're just back into our march. And so the last exercise is the old Harry Worth then, so we're going to take an arm and a leg up to the side, just that movement there. And if you want to make it a little bit more difficult, then we're doing the two arms. We'll start that one in a few seconds. So off you go then, if you would then. So arms up to the side, or one arm to the side, lifting a leg. So there's no need to tilt my body sideways. I'm not tilting my body, I'm keeping my body upright and just pushing my leg up. So I'm really working myself through my hip here and the muscles on the outside of my leg. Quite a hippie movement, this one, so when you get to the end of the minute, you should almost expect there to be a little bit of soreness in your hips. And we'll just do this one for the minute, and then we're going to have a little bit of a break before we restart. And again, breathing out as my arm and leg go up, breathing in again as they come back to the floor. And relax there. So into continuing your march, we're just going to have a little bit of a reset for a few seconds and then we'll restart. So just keep yourself moving a little bit, it doesn't matter how you do that. So just grab yourself a little bit of a drink and just keep moving. Thinking about your breathing all the time while you're doing this, just keeping moving while you're drinking. And then we're going to think about restarting. So again, it's a 30-second countdown before we do the minute's worth of exercise. You can obviously take a break at this point if you want. If you feel you've done enough, then scroll through the video to the end part where the cool down begins, which is about 10 minutes from the end of the video. So just go to that point and go through the cool down if you would. Right, so on to the second half then of the workout. So we've finished 10 exercises. We're just going to do the 10 repeats, just as we were during the time that you've been with us. So again, just going to start the watch for 30 seconds before we start the first minute for the first exercise. So the watch is going, just keeping your feet moving all the time. And just to remind you then, exercise number 1 is going to be that elbow to an opposite knee. So we'll go back to doing that one before. For those of you who've been through a fair amount of the program, you might have seen me do some alternative movements during this second half. If you feel you want to do those more difficult movements, then please feel free to do them. Always listening to what your breathing is doing to make sure you don't go too hard. So ready everyone, and elbow to an opposite knee then, at your pace. Remembering we're trying to get a little bit of rotation in with the shoulders again. And again, if you can't get your elbow to touch your knee, then just try and get as close to it as you feel comfortable. If you feel you need to slow down, particularly on this second round where you might be feeling a bit tired, then please do so. And less than 30 seconds to go. Still thinking about your breathing when you're doing these exercises. So as your elbow goes towards your knee, you'll be breathing out and breathing in again as you put both feet on the floor. And that's the end of the minute, so we're back to a march. And exercise number 2 will be the press up against the wall. So remember, on these linking movements, you should make these as fast or as slow as you want them to be. It's very much up to you. And 10 seconds to go, and we'll start with the press up against the wall again. Hands at shoulder height and shoulder width. So hands up against the wall, and leaning forwards and coming back. So forwards, breathing in, pushing away, breathing out. And again, coming off the heels, so I'm on the balls of my feet all the time. And just as a reminder, you don't want your hands to be too high. If I put my hands up here, that changes the movement. Makes the movement into mainly an arm movement, really. So here I'm using my chest and my shoulders as well as my arms. So 30 seconds to go. Remember to keep up on the balls of your feet all the time. Again, I'm trying to keep my core nice and strong so my body doesn't sag, so I don't want my hips to dip or to lift too far as I move forwards and backwards. And 5 seconds to go. And relaxing there and back to your march. So exercise number 3 on this second round will be in the chair. So we're standing up and sitting down from the chair again. So we're moving our feet all the time between the movements. Do continue drinking if you feel you need to have a drink. Take a break, but keep moving your feet while you're drinking. So finding your chair then, round to the front and up and down from the chair. Sit to stand, just lifting yourself, just using the power of your legs if you can. Bit of a tip then, if you're struggling with any knee injuries, if one of your knees is injured, so let's suppose this knee is injured. If that knee is injured, then I may decide to change my foot position a little bit. And if I move one foot forward and the other one back a little bit, the leg that's closest to me, so the leg that's furthest back, is the one that's then doing most of the work. And the leg where I have my injured knee is mainly balancing me so that I don't stumble forwards. If both knees are the same or feeling fine, then just go back to your normal foot position. And we've got about 5 or 6 seconds left. And relax there. Back into your marching again. And the next exercise is going to be the lateral step. So make sure we're taking a big step sideways, much bigger than we did during the warm-up again. And we'll start this one in 5 seconds. And ready, and starting now then. So stepping across to the side, a big stride, and just tapping that trailing leg behind. So that back leg that you tap it behind isn't taking any weight, it's just tapping, and then straight back in the other direction again. And you want to find some sort of breathing rhythm when you're doing these sorts of movements. So there's not necessarily an obvious place for you to be breathing out. The way I would tend to do it is breathing out, so I push across and then breathe in, so the breathing becomes quite quick. So if you're making the steps quite quick, out and in, out and in, out and in. And less than 10 seconds to go. And back into your marching again. So the next exercise then will be the front lunge. So keep starting from a foot position around about hip width. And as you lunge forward, maintaining that hip position or foot position. So you're maintaining your width. I put my arms out to the side for a little bit of balance. So from the side again, coming down with my back knee towards the ground without actually touching. And let's start now then. So forward and back. As you come forward, I breathe in, and as I push back, I breathe out. And if you notice as well, when I return to my standing position, my feet are still at hip width. If we try to avoid this movement to here, as soon as we start narrowing the stance, our lunge becomes narrower, which affects our balance. So just trying to keep some width and obviously holding on to something if we feel we need to. And we've got about 10 seconds left. And we're back to our march again, and we're going to pick the green band up. And your position that you'll put your hands on the band will affect the tension. So I do remember, the closer I put my hands together, the more the tension. So that's how I can adjust the amount of effort I'm expending while I'm exercising, by moving my hands up and down the band. So obviously if I hold right at the end, there's very little tension. If I move my hands up, it becomes greater. So we'll be tapping behind and pushing to the front. If you start now, I breathe out as I tap behind, and push the band away, and breathe in as I come back to my normal standing position. Obviously, if I decide that I'm getting a bit tired around my shoulders, I can take a break and just tap my feet behind. If that becomes too much still, I can take the movement down to a smaller level, or I can just go back to marching on the spot to give myself a little bit of a break. So that's very much up to you. You can take a break at any point, obviously, but do try to keep your feet moving. So the last few seconds on this one, still pushing the band to the front, both hands at the same time. And then we're back to marching, and ready to grab the hand weights that we've got again. So the next exercise then will be tapping an alternate foot out and into the side, and whichever leg is moving, the same arm then goes in the opposite direction. So across your face, so from the side, across my face, in that movement there. So ready, and off we go then. So tap and push. Obviously I can change the amount of effort I'm expending on these exercises with the weights by changing the weight that I'm lifting. I wouldn't recommend lifting a particularly heavy weight because we are trying to do aerobic exercise. We're not really doing any weight training as such. So we're just trying to add a little bit of resistance. I can also change my speed, and I can also change my range of movement. So if I reduce the range of movement to here, then obviously my effort level is going to go down. And just coming to the end of this minute. And then we're back to marching. Hold on to the weights. We have 2 more to complete with the weights. So the next exercise then will be the leg curls, kicking your heels up towards your backside and rowing the weights back behind you, or pulling them back behind you if you prefer. So the range of movement with your arms is up to you. So the bigger the range of movement, the more the effort. And do try and get your heels up as high as you can. And ready to go. So we'll start now, putting your heels up towards your backside, and rolling your hands back behind your hips. If you've had surgery and the wound in your chest still feels a little bit tender, then obviously you're going to be very careful about making these movements, particularly with any weight in and particularly with any vigour. So always bear that in mind. Just to remind you, I'm trying to kick my heels up as high as I can. So the hamstrings on the backs of your legs need to be worked in the same way as your thighs do. So this is a good exercise for your hamstrings. And about 12, 13 seconds left. And then we'll go back to our march. Please hold on to the weights. And we're back to our march again. And we have 2 exercises left to do then. So the first one will be the little side steps, just as we were during the warm-up, and just pushing the weights to the front, and around about the height of our chin. Do take a drink if you feel you need one. 5 seconds to go and we'll start. And we'll start now. So stepping side to side, pushing the weight to the front. Again, from a breathing viewpoint, I'd be inclined to breathe out as I push the weight away, and breathe in again as the weight comes back to my chest. And we've got less than half a minute to go. And just to remind you again, this is not a punch, it's a push with the weights. And 10 seconds left. At the end of the 10 seconds we can put the weights down. We have 1 exercise to go. Please keep moving. And relax there. Carrying on moving, just marching on the spot. 1 more exercise to go then, which will be the Harry Worth. So the leg going straight out to the side. Try not to tilt your body too much. And either 1 arm coming up, or if you prefer, then 2 arms. And at the end of this minute, I'll ask you to keep moving, please. We're going to go straight into a cool down. Do have a drink when we finish this one. And start now then. So leg up to the side, same arm to the side as well. Just working yourself into your hips. As with all of these exercises, it's up to you to decide the pace that's suitable for you. Always remembering that we don't want to go any harder than the 13 on that scale. And that scale basically says at 13 the likelihood is we're going to be a little bit short of breath. Less than 30 seconds to go, and then we'll be into our cool down. And 10 seconds left, still puffing out as I lift my arm and leg, breathing in as they come back down together again. And relax there. So well done everyone, let's just keep marching. Set the watch back again so we can do our cool down for about 10 minutes. So we'll start that straight away then, start the watch straight away, but if you'd like to get yourselves a drink, and just keep yourselves moving, and once you finish with your drink, just get yourselves into stepping slowly side to side. And as you know, the purpose of the cool down then is to gradually bring your heart rate and your blood pressure back down to a point where we are close to your heart rate and blood pressure readings when we started. So that's the intention, is to try and bring those back down slowly and safely so that we don't take any sudden dips which might make us feel unwell. So we're going to keep stepping side to side, And gradually as we go through the cool down, these movements will become slower and the range of movement will become smaller. And we're going to hold the stretches that we practiced in the warm-up for about 20 seconds or so each time. So just continuing stepping side to side, we're going to pull that arm across your neck again, hold on to the elbow and just pull that towards you, getting a stretch into the top of your shoulder and back, and also a little bit down the side of your body as well. But you really need to pull that elbow towards you in order to get a stretch. And relax that arm, keep stepping and roll the shoulder up and back a few times, loosen that one off, and then we'll try the other arm. And then after a few more seconds, we'll relax that one and just roll your shoulders up and back a few times. And we're going to change the foot movement then, set the shoulders and just slowly tap to the front. So as I say, we're just gradually slowing these movements down. And then we're going to start thinking about doing some leg stretching. So we have 4 different leg stretches to do. First one will be for our calves. So we'll stretch a calf then by stepping forward with your left leg in front. So I'm stepping forward with my right leg just to mirror you. So left leg forward, right leg straight behind you, the back heel is on the floor, the foot's pointing forward, that leg is straight, this front knee is bent. And we're going to stretch into the calf as a result of that. And we're just holding that nice and still for a few seconds so you get a stretch. And if you feel that you can stretch a bit further, then you can just bend the front knee a little bit more and hopefully you get a bit more of a stretch. And relax there, bring the leg in, and we're just slowly tapping forwards again. And we obviously need to stretch the other calf muscle on the other leg then. So we're stepping forward this time with your right leg, put the left leg behind you, same stretch again. Back knee is straight, the back heel is down, and that foot is pointing forwards, and my front knee is bent. Trying to keep myself nice and upright, so my posture is reasonable, and I'm breathing deeply. And relax there. We'll slowly bring the leg in, and now we're just tapping to the side. And this now has become slower than the movement that we were doing previously. And try to avoid shifting your body on this one. All we're doing is tapping the leg out and in. Out and in. We're not stepping side to side. So if I start stepping side to side, the movement looks like this. And here I'm shifting my whole body weight. We're trying to bring your heart rate down so we make the movement much easier than that just by tapping. So second leg stretch then is into the inside of the leg. So I'd like you to take a step out to your left. Hands go onto your bent left knee. Keep the right leg straight. And we're going to stretch onto the inside of your right leg. Keeping my head up high, breathing deeply. Taking my body weight through this bent knee. And if I can't feel the stretch on the inside of this leg, I can push this leg out a little bit further and see if that helps, or I can bend this knee a bit further. But always keeping my head up and always breathing. And slowly coming up from there. We don't want to come up from these movements too fast. And just tapping to the side again. So standing up from these quite low positions, that can cause lightheadedness sometimes, so in order to avoid that risk as much as we can, just come back up from these positions quite slowly, try and keep your heads up. And obviously we're going to step out the other way and do the same stretch for the other leg then, so stepping out to your right, hands onto your bent right knee this time, keeping the left leg straight. Still breathing deeply. And we'll slowly come up from there, and now we're just tapping behind. So the taps behind are really quite small movements, not like they were during the warm-up or during the circuit, and they're really quite slow now. So 2 more leg stretches to do then. One will be for hamstring, and the other one will be for our thighs. So we'll do the hamstrings first. So we'll take a small step forward then with your left leg in front. So I'm going to mirror you again with my right leg. So left leg forwards, hands onto your right knee, bend your right knee, keep your left leg straight. My chest is coming down towards the middle between my knees. I'm still keeping my head up. Still breathing deeply. I should feel a stretch in the back of this leg that's straight. And slowly up from there and tapping behind again. And we'll stretch the other leg then. So right leg forward this time, keep the right leg straight. Hands onto your left knee and bend your left knee. So the front leg will be straight, which will be your right leg. Your back leg will be bent, and that is your left knee. And I'm trying to bring my body down to the middle here. If I take myself off to the side, I can't feel a stretch in here at all. So I really do need to come forwards. And again, I'm keeping my head in an upright position so that I can reduce the risk of any lightheadedness when I stand up. And slowly coming up from there, and now we'll just do our heel lift. And the last stretch we're now going to do then will be for our thighs, which involves standing on one leg. So please do find something to hold on to or lean against. I'm just going to put a hand up on the wall here. When I pull my right foot up towards the right side of my backside, I want to use my right hand. I shouldn't be putting across the knee, so use the same hand for the same leg. So let's just try one of those. Doesn't matter which leg you do, as long as you remember which one it is. Just putting your heel up towards your backside. My knees are aligned in front, they're quite close together, and also they're quite close together if you look in that direction as well. So I haven't got my knees out to the side, if that makes me unbalanced. I haven't got my knee out to the side. So nice and close to each other. If I find this difficult to get into this position, I can hold a trouser leg or a shoe, which I'll show you for the second stretch. And relax there, we're back to doing our heel lifts again. And I'm just showing you what I mean by using a shoe or a trouser leg. So let's try the other leg. I can put my fingers inside a shoe and pull my heel up if that's better for me, or I can hold a trouser leg and pull my heel up if that's better for me. Just enables me to get my body into a good position where I'm not risking my back at all. So if I find myself in this position here where I'm leaning, basically suggests that I'm not flexible enough to get myself upright, then I should probably use a trouser leg or a shoe. So still breathing deeply. And relax there. So well done if you managed to get through the whole circuit, that was a good job. Please carry on with your exercise, and remember that as part of our recovery and part of our lifestyle change, exercise should always be somewhere in our lives. The recommended dose remains at 150 minutes until we hear anything different from anyone. That is the research number that we go with, and I wish you all the best and good luck for the future.